Hey Liz, I'm Catherine. Thank you for agreeing to do this assessment today. So I'm going to be asking you a bit about things that are perhaps troubling you right now, things about your health or about how you've been feeling. Is that okay?
Yeah.
Yeah. It'll be hopefully about 20 minutes, but if you need to stop before then or take a break, you'll let me know.
Okay.
Okay. So we're thinking about how you've been just in the last couple of weeks. Have you had any concerns about your physical health at all?
Physical problems? Okay. No.
Okay. And have you had to perhaps see a doctor about physical problems?
I see the doctor here.
Mm-hmm. Mm-hmm.
Yeah.
Okay. And what does your doctor say is wrong?
He says it's in my brain, so not physical.
Right.
Not the physical thing you said.
Mm-hmm.
So, but I see the doctor here.
Mm-hmm.
This one.
Mm-hmm.
Yeah. Do you know him?
What's your doctor's name?
I don't know. He's quite tall.
Oh, maybe.
Yeah.
Maybe.
Okay.
And has anything changed regarding your appearance in the last couple of weeks?
No.
No. Okay. And in terms of sort of your body, do parts of your body perhaps feel like they've stopped working at all?
No.
No. Or changed in some way?
No.
Okay. I should have said I'm going to take some notes as I ask the questions, so just so you're aware that's what I'm doing.
Okay.
Okay. So in terms of how you've been feeling, have you been worried a lot in the last couple of weeks?
Yeah.
Okay.
Yeah. Really worried.
Okay. And what sorts of things do you worry about?
So in my flat, there's these, I've just noticed recently, there's these new cameras that they've just put in outside the window, but they've turned them so they look right into my window. So they're always watching, and so I've just been staying up at night and watching them all the time. I need to keep an eye on them in case they move again.
That sounds really difficult. And you said there's lots of other things that you're worried about.
Sorry, what?
You were telling me some of the things that you're worried about. Are there other things that worry you at the moment?
Yeah.
Mm-hmm. Could you tell me a bit more about that?
So my boyfriend, he's watching me through the camera, the window, the one I told you. Right. Yeah, I said earlier. So I'm worried about that.
Worried about your boyfriend as well and what he's doing.
Yeah.
And how often are you feeling worried about these things?
All the time.
Okay.
Is that always there?
Okay.
You know?
Okay. So
always.
Is it possible to take your mind off it at all?
Take what? What do you mean?
So when you're feeling worried, can you perhaps distract yourself or put your attention somewhere else?
What do you mean by what's attention?
So when you're feeling worried, can you perhaps do something to stop the worry?
I like to watch TV.
Does that help?
Yeah.
Okay.
Do you think I can get rid of the cameras somehow?
The cameras?
Yeah.
So maybe we can talk afterwards about some of your concerns. Is that okay?
okay, but they need to go.
Yeah, there's a real concern about how they're making you feel.
Yeah, because if they see the camera, they can see how to get into my house, and then I probably need to get rid of the knives in my kitchen just in case.
Okay.
Yeah, they might hurt me.
You're feeling quite unsafe at the moment.
Yes.
Yeah. Okay. How's your mood been in the last couple of weeks?
Fine.
Mm-hmm. Do you have any moments in the last couple of weeks where you've perhaps felt sad or low?
Yeah.
Mm-hmm.
Yeah.
How long does that tend to last for?
It's just always there, you know. Just always feel a bit sad.
Mm-hmm.
It's hard.
Mm-hmm.
It's like when everyone is out to get you, it just makes you feel sad.
Mm-hmm. Are you able to perhaps do things to take your mind off the sadness?
Watch TV.
Mm-hmm. Does that help?
Yeah, a bit.
Mm-hmm.
So I like TV. So, yeah. Do you watch TV?
Mm-hmm. Mm-hmm. When you're feeling sad, does it stop you from doing other things?
No.
No, but it's just there.
I don't do much. Just watch TV.
Mm-hmm. Okay. And in the last couple of weeks, have you had any moments where perhaps you felt life isn't worth living?
No.
Okay.
You just got to keep going.
Mm-hmm. Have you had any moments where perhaps you've wanted to hurt yourself at all?
No.
Okay. And is there anything you feel guilty about?
Sorry, what?
So, when in the last couple of weeks, has there been anything that you've felt guilty about?
No.
Mm-hmm. And have you been thinking about things in the past at all?
Yeah.
Mm-hmm.
Yeah. Just because boyfriend's always watching me, but I haven't actually. I don't think I've seen him for 1 year, but I think about that a lot. I guess that's in the past.
So is that concern, and it's from something in the past?
Mm.
Mm.
And my grandmother.
Okay.
Yeah, she's in the past, but she's always there. It's not just the past; it's now.
Mm-hmm.
Yeah.
Were there ever any problems with your grandmother?
No.
No.
I love my grandmother.
Mm-hmm.
She loved me too.
Do you ever blame yourself perhaps for things? Is there a sense of feeling guilty about things?
No.
No. Okay. And is there anything that perhaps makes you feel ashamed in the last couple of weeks?
What's ashamed?
Feeling bad, feeling that perhaps something was your fault?
No.
Okay. How have you been getting along with people in the last couple of weeks?
I get on very well with my grandmother,
Mm-hmm.
but no one else. I don't trust anyone else.
Mm-hmm.
You can't trust, she's, family, blood. You can only trust family and blood.
Mm. And can you tell me a bit more about your grandmother?
She has brown hair, yeah, and she lived in the number 60 house on my road, so it's only like a few doors down from me. Yeah.
And do you still see her?
No.
No. Oh. Why is that?
She's not here anymore.
I'm sorry to hear that. And have you been getting on with other people? Have you had a chance to see other people?
I get on well with my grandmother. I just said that.
Is there anyone else?
No, that's it.
That's it.
That's it. How many more questions have we got?
So we've got quite a few more, but
Okay.
if you want to take a break,
it's fine.
we
It's
can.
fine.
Okay. Okay. Have you had any moments in the last couple of weeks where you've perhaps felt a bit irritated?
Like happy?
Like sort of feeling a bit angry or annoyed?
Okay. No.
No. Okay. And has there been any moments where perhaps you've shouted at someone in the last couple of weeks?
No.
Okay. So we've asked about some difficult feelings. Have there been any times where perhaps you felt really good in the last couple of weeks that perhaps is out of your usual self?
Is that like the word you said before? So happy.
So
Yeah.
happy, sort
Yeah,
of feeling
yeah.
really good and
Yeah.
warm and...
Not really. No.
Okay. Is there anything that you have some special abilities at all?
I think if I try really hard, and I've been practicing this, I can probably get rid of the cameras without touching them. So, yeah, I'm working on that at the moment.
How might you do that?
So with my mind, I think. You know, like, have you seen Harry Potter?
Oh, yes.
Stuff like that, yeah.
And how often have you been thinking about getting rid of these cameras with your mind?
Every day, because I'm training.
Uh-huh.
Yeah. There's some like good videos online about it. If you're interested, I can send them to you.
Okay. Have you told anyone about this training?
Just grandma. Yeah. She was the one who told me to do it.
Okay.
Yeah. She said it will help.
Okay. And have you acted on any of her suggestions?
Just to watch the videos and to learn and read a book about it as well. Yeah.
Okay. Do you ever have sort of feelings of being uncomfortable when you're out and about?
Yeah. I don't go out much at all. You know how it is. Just better to stay inside.
How often have you been out in the last couple of weeks?
Once or twice, maybe. I don't know, I don't count.
And what is it that makes you feel uncomfortable when you go out?
I just feel like everyone's watching me wherever I go. Like the other day, I was on the bus, everyone was definitely watching me.
And are you concerned about people's intentions towards you?
So
When you're out and about, are you ever worried about what people might want to do in terms of how their intentions towards you?
But I just go to the shop. I don't understand.
You said you're sometimes feeling uncomfortable because it feels like people are watching you. Are you worried about what they might want to do to you?
Yeah. So I think everyone, they're watching me and then they're thinking about how they could hurt me. And I think they're all planning together. And I think on their phones they can see the camera and what into my flat. So they can all show that to each other, and then.
And how often are you worried about this?
All the time.
Have you told anyone else about these experiences?
I tell the doctor here. Do you know him?
I don't know who your doctor is, but maybe. Okay. And do you ever seem to hear your name being called? Perhaps when you're on your own.
Yeah.
And what do you hear anything else? Does it say anything else?
It's a bit confusing. So there's two different voices.
Okay.
So, like I said earlier, with my grandma. Yeah.
So one voice is your grandma.
Yeah.
And how about the other voice?
It's my boyfriend.
Okay.
But that's not a very nice voice.
And how do you find these voices? Can you do things as normal?
I can't find them. I don't know where they are.
In terms of
It's hard.
In terms of perhaps when you're doing things you would normally do, does it make it easy or difficult to do those things?
Yeah, sometimes when I'm watching TV, they're just really loud, and I just want them to be quiet so I can watch TV or watch my videos so I can learn. But they're very, very loud, and sometimes both at the same time, and I just can't understand what they're trying to say.
How often do you hear them?
Most days.
Do they ever stop?
Yes, when I go to sleep.
Okay. And when you hear these voices, do you ever receive special messages from them?
Well, Grandma, she's special. And she says I'm special.
And does she ever tell you to do things?
Yeah. Yeah. Well, she doesn't tell. I don't have to do them. But it's nice to hear her voice. I miss her.
How about your boyfriend's voice? Does he tell you anything that you need to do?
Yeah, he says, I'm going to hurt you. I'm going to come and get you. Okay. And I think there's someone else involved as well.
Right.
Yeah. I think he's got a team of people, and they're always watching. They're always there. And yeah, someday. So I bought new bolts for my door yesterday. From the shop down the road. Yeah.
Okay. Have you told other people about these experiences?
No.
No. Can you explain these things that are happening?
What? What do you mean?
Is it possible to explain the voices? What they're telling you to do?
I think so. I think if someone put a microphone close here, they could hear it too, so then that would explain it to them. Mm-hmm. Would that be helpful? Yeah.
Okay. We're nearly there with the questions. Okay. Is there anything in the last couple of weeks that perhaps has attracted the attention of other people towards you?
I don't see anyone else.
Okay. And is there anything you've done that perhaps might have got you into trouble?
No. I stay out of trouble. Mm-hmm. Grandma tells me it's better to stay out of trouble, keep hidden.
So you tend to stay at home?
Yeah.
Mm-hmm. And is there anything that you've done perhaps that might have seemed a bit strange to other people?
No, I think if anyone else was in the same situation as me, they'd understand. They'd do the same. It's not very nice. Mm-hmm. When everyone's watching you, you never get any time to yourself. So I don't think that's strange.
How have you found looking after your appearance recently?
Not good.
No. Has it been difficult then?
Yeah. I used to spend lots of time getting ready, but now there's no one to impress.
Okay. How often are you able to perhaps take a shower?
I don't shower, I take bath. I have a bath every 2 weeks. That's what Grandma says is best.
Okay.
Because you've got to save water as well, because they might be able to send these new microbes that link up with the cameras through the water. So if I have more baths or use the shower, then they can send it through, and then the more water that comes through, the more chance it is that they come through, and then they can attach to your body and they can track where you're going at all times, and of course that will make it easier for them. So
there's
stay out of trouble.
It sounds like it doesn't feel very safe to have a bath then.
No.
In terms of eating, have you been able to eat regularly?
I'm not very hungry. Yeah.
When was the last time you had a meal?
Today. Yeah. I got some food downstairs.
Maybe have it after this.
Maybe.
Yeah. Okay. So I just have some questions that we ask everybody. And can you tell me, how old are you?
25.
Okay. And what's the date today?
It's June.
Can you tell me the year?
2018.
And do you want to have a guess at the date, the actual number for today?
I think it's near the end of the month, but I don't know what date. I don't have a calendar.
Okay. And what's this place called, where we're at now?
Office room?
And do you know which hospital we're in?
No.
Newham. Okay. What year were you born?
1983 or 93, I don't know, I can't remember.
Okay. And can you tell me who the Prime Minister is?
No, I don't watch the news.
Okay.
You can't trust anything anymore, can you?
Okay. So I think that's the end of all of my questions. Is there anything you'd like to ask me or anything you'd like to talk about before we finish?
No, it's fine.
Okay. Thank you ever so much, Liz.
Thank you.